taking tonsils and adenoids out is one of the most common surgeries done in the United States today and in the worldwide. It's a very ancient procedure. The first tonsillectomies were done during the ancient Greek times. Since it's such a common procedure, there's been always a desire to develop new technologies and new techniques to remove the tonsils. Most of these revolve around the concept of trying to reduce the post-operative pain after tonsillectomy. The pain in the throat after tonsillectomy is the most feared adverse effect of the surgery, and it can last up to 1 or 2 weeks post-surgery. So over the years, there have been developments, technological developments in manufacturing different devices that are supposed to make the surgery quicker, make it safe, and also reduce the pain. All these technologies involve using different sorts of energies in the mouth through a machine that has a handheld device which transmits different types of energies to the tissue, and that enables us to remove the tonsils from the tonsil bed in the mouth with ease. And the different devices are meant to provide different types of energies that hopefully will reduce the amount of energy that is absorbed into the surrounding tissue and reduce the consequences of pain and discomfort after surgery. However, at Children's Hospital of Michigan, we tried to develop a new way of looking at doing this surgery. And we went back to the old techniques of taking the tonsils out using cold instruments, basically scalpels and different knives, and without using any energy at all in the mouth. After we removed the tonsils, we used certain chemical substances called hemostatic sealants, which were initially used in cardiovascular surgery to prevent bleeding. And we tried to put these chemicals on the tonsil bed after the tonsil was removed to see if we can stop the bleeding from the tonsil bed after surgery. And that happened to be very, very successful. Over the years, we've fine-tuned and developed this technique. Basically, now I remove all my tonsils using cold dissection, which means taking them out without any use of any energy at all in the mouth, and stopping the bleeding using hemostatic sealants. The technique is extremely safe, as quick as any other high-end technology out there, but the main difference is that since I don't use any energy at all in the mouth, there's no consequences of any burn or any reaction in the tissue, and we have found that it reduced the pain significantly, at least by 75%, if not more. And most children will be eating food the same day of surgery or at the latest the next day. The discomfort in the throat is reduced to maybe 2 or 3 days, and the recovery is extremely quick and fast. Also, other side effects of doing tonsillectomy using different types of energy, such as very bad breath, scar tissue, and eschar at the back of the mouth, those are all eliminated with my technique. So you can call it painless tonsillectomy or near painless tonsillectomy, but it's definitely a breakthrough. Right now, we are also in the process of starting a large study comparing our technique, which we have been using for at least 5 years without any problems, to the existing other techniques to show our results.